Iowans 65 and up can now call 211 and speak with a vaccine navigator who will take their information and schedule an appointment for them at a nearby Hy-Vee pharmacy. The program just started yesterday, and in the first day alone, 211 received 1,600 calls and scheduled more than 1,100 appointments for older Iowans who hadn't been able to get one yet. Due to the large volume this week, Hy-Vee will be setting up clinics in Des Moines and Cedar Rapids to accommodate the immediate needs of this population. 211 also has multilingual care navigators on staff, plus access to translation services that cover 240 languages, helping us better serve Iowans of all backgrounds. As the program continues, we'll be assessing how it could be extended to even more Iowans who may struggle with scheduling appointments on their own, whether that's due to barriers with technology or even language. So as you know also, we received our first shipment of the J&J single-dose vaccine last week and immediately allocated 25,600 doses to begin vaccinating. Workers who had been essential to critical supply chains moving over the last year, including those at food processing, egg production, and manufacturing and distribution companies across the state of Iowa. Our plan is to vaccinate nearly 160,000 employees who work or live in congregate settings over the course of the next 5 weeks. I'm pleased to report that the first week of employer vaccination clinics is nearly complete at 51 food processing plants located in 17 counties, and according to our most recent report, more than 18,400 workers have been vaccinated, and we think that's actually higher, but we're still entering the data. While Johnson & Johnson allocations will fluctuate until later this month, we, with minimal amounts of J&J in Iowa, with minimal amounts being allocated, Iowa may receive at least 4,000 doses, and then once we receive those, we'll allocate those, and then next week, hopefully with more J&J, we'll restart workforce vaccination efforts across the state. Many companies have already arranged to host vaccination clinics for their workforce with their local public health departments or local Hy-Vee pharmacies. So we'll continue to make progress even as we wait for our Johnson & Johnson vaccine allocations to resume and stabilize. Finally, later this week, we'll update the vaccine dashboard at coronavirus.iowa.gov to reflect the administration of the J&J vaccine, so that will also be accounted for on the website. As vaccine production continues to ramp up and the White House projects weekly vaccine allocations to increase in the immediate weeks ahead, we've been able to further expand eligibility to include individuals aged 16 to 64 with pre-existing health conditions that could put them at risk for more serious illness from COVID-19. Expanding eligibility was also necessary because a number of the counties were nearly done vaccinating other eligible groups in their area. And as I've said before, we need to do everything that we can to keep this vaccine moving. Nothing should unnecessarily hold up the process. So when counties are ready to move to the next eligibility tier, we must enable them to do so. We also want to help counties keep pace as the number of vaccine doses and eligible Iowans continue to increase. Last week, I did have the opportunity to visit 2 extremely impressive community vaccination clinics, and I got the opportunity to see firsthand the level of coordination that it takes to ensure not only a high throughput, but really how seamless the operations were put together from start to finish. On Friday, I visited a clinic that was hosted at Vermeer Corporation in Pella with the Marion County Public Health. And then on Saturday, I went to Fort Dodge, where the Webster County Public Health Department held a clinic at the Crossroads Mall. Both were just outstanding examples of communities working together and leveraging their unique strengths to serve a public need. Today, I am pleased to be joined by David Corbin. He's the Vice President of Environmental Health and Safety and CIO at Vermeer Corporation. And David is going to highlight how Vermeer approached their local public health department to offer their facility for hosting community clinics and then designed a process to ensure efficiency and scalability. So clinics could grow as vaccine supply increases and more people become eligible. So David?
Good morning. And thank you, Governor Reynolds, and thank you to your team for leading our state through this difficult time. I think many of us see a light at the end of a tunnel at this point in time. I also want to thank young lady Jen West and her team for their daily care of our Vermeer team and their families. Jen is also a Premise Healthcare team member and manages our Vermeer on-site clinic. And lastly, a big thank you to Kim Dorn. Kim and her team are at Marion County Health, and I want to thank her for their resources, wisdom, and direction. You see, Vermeer Corporation is not a healthcare clinic. We are an equipment manufacturer. We develop, deliver, and service industrial and agricultural equipment for the benefit of our customers and our communities. In doing so, our focus is on process improvement and teamwork. You know, team, together, everyone accomplishes more. So caring for our team members, their families, and our community members is of core importance to Vermeer Corporation. It's part of our core values and principles. For some time now, we've worked alongside Premise Health to offer Pella team members an opportunity to use an on-site clinic and pharmacy, in addition to other area healthcare providers like Pella Regional Health Center. We believe in partnerships, public and private, partnerships enabling groups to do what they do best, focusing on solving problems together in our communities. As many of you have done when this pandemic started, we stood up a response team and a call center, promoting protocols and providing direction to positively influence the health of our team members and their families. Before vaccines were available, we partnered with Premise and Marion County Health. We procured the necessary equipment, set up in a portion of our Vermeer Global Pavilion, which you can envision it to be about the size of a football field. We set up a vaccination process and applied for a pod, or point of dispensing. Following the orders set forth by and under the direction of Marion County Health, our shared objective is to offer vaccines to our community members. And together with Marion County Health's leadership, we continue to revise and improve the process. So, on February the 5th, we held a small test clinic for 200 people. And last Friday, as the governor mentioned, 10 nurses and 60 volunteers vaccinated 800 people. And we believe through that experience, we can vaccinate as many as 2 times that amount in a day. Using a mass vaccination clinic approach like this is scalable as supply and eligibility increases. We knew that the vaccine supply would initially be the limiting factor, and then anticipated the limiting factor might shift to distribution. We want to encourage other organizations throughout our state to consider standing up similar operations, and if we can help, we'd be more than willing to share what we've learned in the spirit of teamwork and caring for people. We are ready for the vaccines, Governor. We've proven together we can do this, and we're excited to help move our community and our state out of this dark tunnel and into the light. Thank you very much.
Thank you, David. Vermeer certainly brings a unique skill set to the effort, and it is a real testament, I think, to the value of teamwork between your organization and the local Department of Public Health to serve the people in your area. So thank you so much for stepping up to make this possible. I also want to thank the Marion County Public Health team and the team in Webster County for the work that you've done and continue to do in your communities as well, and maybe we'll get a chance to highlight their process as well. It was a pleasure visiting your clinics last week, and it makes me so proud to see this type of progress happening across the state. So let's keep it up, and thanks to everyone for everything that they're doing. So finally today, I want to address another important topic, and that is Iowa's child care crisis. Access to affordable high-quality, child care in the state of Iowa is certainly an issue that precedes the pandemic, but it was intensified during it. From the public health threat that caused some child care centers to reduce spots or close entirely to the economic impact on so many Iowa families, the shortage of child care was again in the spotlight. It's an issue that we seem to tackle every year, but we've yet to come up with the solutions that not only resolve the immediate needs of working parents, but it creates a long-term sustainable system. In its final report to me, the Economic Recovery Advisory Board identified child care as the #1 opportunity for economic growth as we continue to navigate our recovery from COVID-19. And they recommended convening a group of Iowans to develop a strategic plan. I'm pleased to announce that later today, I'll be issuing my 8th executive order establishing the Governor's Child Care Task Force, which will be chaired by Emily Schmidt. She is the General Counsel of Soup Cup Manufacturing and a working mom who served on the Economic Recovery Advisory Board and is passionate about improving access to child care for hardworking families. I'm really grateful that Emily is here with me today to provide some additional information about the opportunities ahead and really her goals for the task force during its 100-day work session. Emily?
Thank you, Governor, and good morning. My name is Emily Schmidt, and I work for a family-owned and operated soup cup manufacturing company. And I'm a mother of 2 daughters, and my husband, Andy, also works. And we have many family, friends, and colleagues who are also working parents. And it was an honor to serve on the Governor's Economic Advisory Board. And our goal for that was to identify areas of strategic growth for Iowa as we move forward from this COVID-19 pandemic. The report we released just this past month identified the priority to confront and address Iowa's child care crisis. While Iowa has the highest rate in the entire country with households of all parents working, we also face a shortage of high-quality child care in every corner of the state. One estimate calculates this shortage to be 350,000 child care slots statewide. One term you're going to find in the report uses is child care desert. This means that there are 3 or more children that need care for every 1 existing child care slot. Unfortunately, 23% of Iowans live in a child care desert. When you look at rural Iowa, which is where our manufacturing facility is in Sheffield, Iowa, this stat goes up to 35%. One of my goals with this task force is to take an expansive view of Iowa's child care needs. I work in manufacturing sector, which is Iowa's top by GDP. I've seen firsthand that child care availability directly impacts our workforce. We also cannot ignore that 60% of the workers that left the workforce in this past year were women. The pandemic has disproportionately affected women's opportunities for pursuing for careers and advancement, and that is a reality that we cannot accept. Some of our actions for this task force will be to study successful delivery models from other states. We will work to identify the correct regulatory environments to foster both safety and quality. We are also going to think of how to incentivize Iowa employers to be partners with this child care assistance. And we're going to measure our success with the goal of increasing Iowa's child care slots by 50% within 5 years. Governor, thank you for taking such swift action on this task force because it's going to benefit all Iowa families. And big challenges really require bold solutions. And within the next 100 days, we're going to have necessary and productive conversations on this topic because we're going to be addressing this major challenge facing us Iowans. Thank you, Governor.
Thank you, Emily. And I so appreciate your willingness to lean into the leadership role and the unique perspective that you offer on Iowa's rural communities. As you said, access to child care is an issue in every single corner of our state, and we need to do everything that we can to resolve it so that every Iowa parent can pursue opportunities to better themselves and their families. In the meantime, Many communities across the state have been working hard to develop and fund local projects that address child care access and support working families. Today, the Department of Human Services and Iowa Workforce Development will award more than $13 million to support the expansion of child care in communities across the state. Together, the two agencies reviewed more than 70 applications, then leveraged the best available funding source for each project to ensure that every eligible applicant received the maximum amount possible. I want to thank Beth Townsend, who is the Director of Iowa Workforce Development, Kelly Garcia, Director of the Department of Human Services, and Janae Harvey, the Department of Human Services Division Administrator for Adult, Children, and Family Services, and Taryn Frederis, who is a part of my team, for their teamwork and collaboration to make this possible. As we sat around the table in my office and I listened to them talk about the eligible funding opportunities to see how we could really braid that funding and collaborate together to really allocate it in a responsible manner was exciting. And so I think this is a great place to start, and it's just going to be great timing for the Child Care Task Force to step in and take what we're hearing and really build on that. And so I'm excited about the future. The Department of Human Services will reward more than $12 million through its Investing in Iowa's Child Care funding program, which provides financial support, personal training, equipment, and supplies for new or existing child care facilities. And then another $1 million from the Future Ready Iowa Child Care Challenge grants that's ran through the Iowa Workforce Development will support community projects that establish local child care facilities. So one of those award recipients is the Grundy Community Preschool and Child Care Center in Grundy Center, which will receive a Child Care Challenge grant in the amount of $97,500 to fund the construction of a new space in the former upper elementary school building. This community-wide project will result in additional 36 child care slots and so much more. So here to share more about the impressive project and what it will mean for the community is Melanie Hoy, and she is the board chair of Maroon and White. It's a nonprofit dedicated to supporting child care and early education in Grundy County. Melanie?
Thank you, Governor Reynolds, the state of Iowa, and Iowa Workforce Development. I am delighted and grateful that you have chosen our project for one of your awards for the Future Ready Iowa Child Care Challenge Grant. The nonprofit Maroon and White was formed with a vision and purpose to accomplish two things: to restore and preserve a school building in our community and to increase availability for quality, affordable child care services. An alumnus who attended the school in this very building kicked off our project with a very generous donation of $500,000. And it's been interesting, to say the least, to attempt to fundraise amidst a global pandemic, having to cancel many in-person fundraising events, but yet we have persevered. The school building was built in 1939 as a high school and operated as such until the late 1950s. It was then home to the junior high, which I attended, and lastly as the upper elementary for 5th and 6th graders until the early 90s. Since then, the only licensed preschool in Grundy Center has operated in the building, along with the YMCA before and after school programs, the Y Summer program, along with Head Start offices. The project, which we have named the Kid Campus, will completely renovate the entire structure to not only allow the current tenants to remain, but will also allow the community daycare to relocate into the building. Both the Grundy Community Preschool and Daycare have significant waiting lists. And with this renovation, we will be able to add classrooms and daycare space to allow for an increase of over 60% for both the preschool and daycare. The building is also located on the grounds next to the elementary, which provides a level of convenience for parents that may have children in both the elementary, preschool, and/or daycare. We call it the one-stop shop. The playground area will be named for a young mother of 4 in our community who sadly recently lost her battle to cancer. As we know, child care services are so important to young working families. This will help in retaining and recruiting young families to our community. But it goes beyond that. It provides an important role in economic, business, and community development. This money will allow us to start interior work this spring on added additional classrooms, a new commercial kitchen, and laundry room. This building holds many fond memories for all that have walked the halls in the past, and will provide now an updated, modern, safe, and healthy facility to ensure a bright future for generations of children to come. Thank you so much.
Thank you, Melody, and congratulations. We're excited to come see the project when it's complete, and I wish you much luck through the renovation process. There are a lot of good things happening in Iowa, from our progress with vaccination to getting back to business as usual and resolving issues like childcare that will even further fuel our economy. These are just some of the reasons why Iowa is ranked #1 for opportunity. As announced just yesterday in the U.S. News & World Report state rankings for 2021. So even though we already knew that opportunity lives here, we can be very proud that our state has been recognized across the country. I know that I certainly am. And with that, we'll go ahead and open it up to questions.
Governor, why not open vaccinations to everyone? There are a couple of states that have done that already, especially since there's no requirement that a person getting a vaccination prove that they have one of the conditions which would put them on the list currently.
So I think we have a good process in place, Kay, and as we see those numbers continue to increase and we continue to open up and vaccinate more and more Iowans, we'll take that next step. But right now, because of the progress that we've made with 65 and up, because we've had 70% of our first responders, daycare providers, and teachers that have been vaccinated, we're now able to open it up to essential workforce, manufacturing, as well as individuals that are homebound with disabilities and individuals that are 18 to 64 with underlying conditions. And honestly, that's a large segment of our population. And so in sense, we have somewhat done that. But I think we've demonstrated that as we continue to scale the ability to do the clinics and to reach Iowans, that we have made it possible for the different counties to move into the next tier when they've met the criteria in each of the ones that we've laid out. So every day we're evaluating that, and we're talking about what makes sense for us to move forward and to just, it's based on the allocations that we get. So we had a great start to J&J, 25,600, and they're out the door and they're being utilized. But we may not get anything this week, or at a minimum 4. They're not saying what we'll get the following week. Now, with the partnership with Merck, we know that they've projected will increase significantly, especially by the end of June, but we're not there yet. And so we saw our retail pharmacy numbers went down just a little bit this week as well. So we just need a little bit more stability, and then we can start to continue to have those conversations.
Governor, related to Kay's question, we've heard Iowans who are not eligible to get a vaccine in their home county are going to neighboring counties where they might be eligible. Is that appropriate?
Yeah. If they can, you're seeing that with some of the regional sites. I mean, when I was up in Fort Dodge this Saturday, they were vaccinating individuals from probably a 60-mile radius. So, people are calling and trying to figure out where they can get a vaccine, and I think they're willing to drive. So it's an Iowan that's getting the vaccine, and I think that's fine.
Governor, Iowa is receiving international attention because there's a Des Moines Registered journalist who's on trial after she was arrested while reporting on a protest. There's a lot of concerns about press freedom. Do you have any response to what's going on with that? Anything you want to say about press freedom in the state?
No, I'm not. I don't have any comment on that. We'll continue to let it work through the process. We'll see where it ends up, and we'll let the process work.
Governor, did you get any sense from the call with the administration this week about where J&J will go kind of past 2 weeks from now? Did they get into April projections, and would
Yeah,
that?
I think I should have that. They didn't on the call, but I think early projections were, I think they were 20 million first, but I think they were saying, how much was it by June, huh? It's significant. It is, it's really significant. By the end of June, the number was significant. And Dave, we can get those to you. I don't want to misquote it and then have it be wrong, but I think it was in the 20 millions for April and then a significant increase by June. It will be a game changer.
Sorry, just to get to K's then, will Johnson & Johnson kind of be that production necessity before it can be opened up to everybody, do you think, or can it happen before that?
I think we're projecting with the J&J that we anticipate receiving that we'll be able, including some Pfizer and Moderna. So there are you asking about manufacturing and essential workforce and really utilizing it for that? So we're seeing them. Yeah,
Switch for
yeah.
everybody.
So we 4 weeks. I mean, we've already moved some up, and again, that's our projection, but it's based on the allocations that we get. But I think we're quickly going to see this shift to where we've got a lot of vaccine coming into well, President Biden said he believed that everybody that wanted one would be eligible by mid-May, I think was his projection. So, I mean, that gives you a pretty good indication of what we're hearing and what the expectations are for the ramp up. So manufacturers and processes and distribution centers are using the J&J because it's a single shot. It's just easier to coordinate, but they're also coordinating with their local public health and Hy-Vee to utilize Moderna and Pfizer as well. So that's a part of the mix with some of the companies as well.
So how will you notify Iowans when everyone else,
Well, just like we did, press conference,
Okay.
and so it'll come through the shortage order is how it will happen, just like we did before. And the reason, we made the change on that, David, is because some of the counties were through, and I do not want them sitting on vaccines. That's the last thing we want. We want to make sure that we're doing everything we can, especially while they're limited, to get them into the arms of Iowans. And so they're ready to go, and we want to make sure that we're not the ones that are holding them up. So if you're there, you can move through the different tiers. Not everybody is at that place in some of our larger communities, but they're getting close.
So someone who's 50 years old and has no underlying conditions, you're thinking maybe sometime by May? I mean, I'm just 50.
I think it will
I'm just
probably be,
pulling out
I don't know. We'll see.
Okay.
But I'm very cautiously optimistic that we're going to continue to see these numbers go up. We're doing a good job of getting, a large percentage of the populations that we're targeting vaccinated, which allows us to move on. It's just the first week in March, right? Are we still the first week in March? Yeah? No? Second? Okay. Second week in March? Second? Okay. So I think we're going to see a big change at the end of March into April. April's going to be a big month.
Governor, I've been seeing some reports about like a surplus of vaccines out there. The last report I saw was like 1.1 million vaccines being allocated to the state of Iowa, but only about maybe 600,000 being administered. Now, of course, I do see your recent report saying it's now close to 1 million doses being administered, but what has there been like a lag then in reporting between shots getting arms and shots getting to the state?
Well, as I indicated in my remarks, we anticipate vaccinating the millionth Iowan by this week. Sometimes it's a lag in the reporting, but I think we're getting better on that as well. But there's not a surplus of vaccines in the state of Iowa. Let's just make that clear. We are doing a great job of working with our local public health, our Department of Public Health, our private sector companies, our retail pharmacies are doing a great job of getting it out. And there's just unbelievable coordination happening across the state. Hospitals and clinics are a part of that as well. And so we are, and otherwise you wouldn't see the numbers that we're seeing. So if you go on the website, you'll be able to see where we're at. CDC has a website that they update daily, and we're just about to hit the millionth Iowan vaccinated.
Do you have a deal on broadband, and what is it?
Well, it's never done until it's done, Kay, but we're having some really constructive conversations from the policy piece of broadband. I'm excited about that. It is a priority of mine, and I believe it's a priority of the legislature as well. So we're working together to make sure that we can find some common ground to move the bill forward and hopefully move Iowa in the direction that it needs to move. You know, I've talked about that a lot. We're not anywhere where we need to be. It brings equity to the entire state, and especially with what we just went through last year, it underscores how important it is that we have high-speed, reliable, affordable broadband. And we just allocated that last $15 million that we had to hold because we couldn't get it done within the year, and when they extended that. And we had a lot of interest in that, 3 times the amount request of the $15 million. So I think we've got kind of the right parameters in place to get this money out the door and start to get Iowa connected, competitive, and give every opportunity for every single of the corner of the state to grow and succeed.
The state having received about 25,000 doses of Johnson & Johnson last week, when do you anticipate the next time the state will have this many doses coming in? You mentioned June as a ramping up.
Yeah.
Is that going to be the next time?
Well, so we're hoping minimal, or if we don't know if we'll get any, potentially 4,000 is what we were told on the call the other day. But that's about the percentage we get for the overall allocation. Next week, I think it'll still be probably a little volatile, and then we're hoping the week after that we'll start to see them ramp back up. But I'll know more next week at the press conference because we will have had a White House call, and so we'll have maybe a better idea of what those numbers look like next week. Okay?